Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a problem of middle age when you used to lose hair, of thinning of hair, or bald patchy hair. However, with increasing pollution and the increase of stress in the daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today, we have with us Dr. Aditi Dubey. Is a well-known dermatologist and has been practicing medicine for over many years now. She's M.B.B.S. M.D. in skin, specializes in dermatology, cosmetology, and hair transplant. Currently, she is practicing as dermatology at Dubey Multispeciality Hospital, Bilaspur, Chhattisgarh. Dr. Aditi has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Aditi is aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Aditi, for sparing your time and being there with us in this show to answer a few questions on hair care for us today. Welcome to this show.
Thank you so much, Mona. Thank you.
Thank you so much, Doctor. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So, Doctor, we are today going to talk about hair care in current scenario, and whenever we talk about hair care in current scenario, the most common problem which is faced by all of us, irrespective of gender and age, is the hair loss. So, can you
Yeah.
please enlighten us today with your profound experience, like what is hair loss, what's normal, and when to be concerned for?
Yeah, see, this is a very common question which is asked by many of my patients also, because
Hmm.
even if they see 20, 30 strands that they are losing per day, then also they feel it's hair fall. And sometimes there are certain people who are losing more than 200 strands and still they are not concerned about it.
Hmm.
So ideally 50 to 100 strands per
Hmm.
day if you're losing, this is totally normal. So
Hmm.
it's a part of your hair cycle. It's totally normal. But yes, if
Hmm.
it is more than 100, yeah, it's much more than that, then you need to go and see your dermatologist and you need to get your consultation done right away. So that's where you need to, that's a red flag.
Okay, so more than 100 is a red flag, and we should go to the
Yeah.
doctor at that time. Okay. So, doctor, there is one more confusion between people, like people that we don't know that why does the hair loss like what is the cause of it, the hair loss, why it is happening, like, so can you please enlighten us, like what are the general causes of hair loss?
Yes. See, most neglected and the most basic cause is scalp hygiene. According to me, this is the most neglected thing.
Mm-hmm.
People do not take care of their scalp the way they should. Washing your hair frequently, washing your scalp, you need to set a frequency of hair wash. Then, if you're keeping oil in your hair and you're not washing it, then again, it's a source of dirt and sweat and everything is accumulating. So,
Mm-hmm.
one important cause is scalp hygiene. You have to be careful if you have dandruff, then you need to treat it.
Mm-hmm.
Secondly, there are so many deficiencies in our country. We the diet that we take. So, iron deficiency anemia is so common in our country. Young
Mm-hmm.
girls, women, everybody they are facing it.
Mm-hmm.
So, when your iron stores are going down, then again it's causing hair fall. Then next, hormonal imbalances. Like for example, most common is thyroid, which is
Mm-hmm.
again very common here. So
Mm-hmm.
thyroid is again directly proportional. If your TSH levels are high, it will cause you hair fall. And
Mm-hmm.
lastly, I would say that even certain drugs and medications. If you're on
Mm-hmm.
any kind of medication for a long period of time, it could
Mm-hmm.
be a side effect. The hair fall could be a side effect of that particular medication also. So you need to
Mm-hmm.
talk to your dermatologist about it so that
Mm-hmm.
they can figure out what is the root cause. And there are
Mm-hmm.
many more other causes actually, which come in light when we take proper history from the patient.
Okay, so if you have other comorbidities condition, then also hair loss can cause. So it is
Yes.
very important to get our regular health checkup so that we can know that why the hair loss is happening anyways. So doctor, like you said that there are many more, and scalp hygiene, and this is also important. So along with this, one thing is like today in this era where we are working so hard, and day and night, and there's no like time for sleep and eat, we don't have time to even cook, we eat whatever it is available for us. So can a person lifestyle play a role in hair loss?
Absolutely. Lifestyle plays a very important role because your eating pattern, your sleeping pattern, then, any kind of stressful environment you are in, because sometimes, if you're working 9 to 7, even this young girls who are going to school and they've been asked to make it their hair particular way and they have to go, and you don't get time to take care of it. And other
Mhm.
things is the stress. Now, be it financial stress, be it emotional stress, or be it physical stress. Now,
Mhm.
physical stress is something like, even if you have had a viral fever in recent times, if you've had typhoid or any other stressful condition, any surgery, any minor operation, even that will also result in some amount of hair fall post that procedure. So, any kind of stress to your body will
Mhm.
result in hair loss. So, lifestyle is very important. What you eat, everything.
Okay, okay. So lifestyle is very important, irrespective of any comorbidities. If you have, we should have a good lifestyle. So
Especially for our generation, lifestyle plays a very important role.
yes, doctor. So, doctor, like there is a lot of confusion now. Like now that we know that what's hair loss and when to be concerned for and the causes. So there is a lot of confusion for another thing is that the treatment process. Like so many people are scared of not and lack of confidence, and they don't go to the doctor because they think that kya koi treatment hoga bhi ki nahi hoga. So, like, can you please enlighten us what treatment medical options are available for hair loss management, like surgical, non-surgical, or is there any other treatment also available?
Yes. See, actually, the patients, firstly, hair loss is and the journey of treatment. It's actually long, especially when it comes
Mhm.
to hair. So,
Mhm.
patience is the key to it. And we actually combine orals and, topicals. So, what we do
Mhm.
is we are actually supplementing them with multivitamins and other things to just support the deficiencies. And
Mhm.
also topicals we prefer giving. See, particularly if it is active hair fall, then I don't
Mhm.
start minoxidil. I usually give them minoxidil free preparations. There are
Mhm.
very famous ingredients like procapil,
Mhm.
redensil, capexil, all these
Mhm.
serums for the scalp. They're very good. Once the
Mhm.
hair fall is under control, you can start with minoxidil. And then
Okay.
if you have very severe balding, then we have oral minoxidil also. Then we can
Mhm.
go for procedures like PRP. I think most of the people would be aware of it. That is
Mhm.
platelet rich plasma. So we are taking
Mhm.
out your own platelets from the blood and injecting it into the scalp.
Mhm.
Next is GFC, growth factor concentrate therapy. These are pre-prepared growth factors, so they are a little expensive, but
Mhm.
this has very good results. And now new
Mhm.
exosomes are coming up. This is also latest technology. And then
Mhm.
lastly, if you have very severe hair loss, then you have to go for hair transplant, which is a last resort. So medically,
Okay.
we try to manage as much as we can.
Okay. Okay. So there are like wide variety for varieties of treatments are available. People don't need to be scared of and staying at home. Ki yaar pata nahi kya hoga. It's better to visit the doctor, and I think so doctor can help. Okay. So, doctor, like you said that diet is important in this era, lifestyle is important for us. So, like, there is one word in this diet and this era of lifestyle is nutraceutical, which is getting a lot of focus. So can you please enlighten us today, like, what is this nutraceutical and what is the role of this nutraceutical in hair health?
Yeah, there's a lot of hype about nutraceuticals and all those fancy hair gummies on the social media. See, I'll tell you one thing, your nutraceuticals cannot bring your hair back. This is one thing. But
Mm-hmm.
these are all adjunctive therapies. They can just support the treatment because
Mm-hmm.
these are all multivitamin preparations. So, to some extent, yes, they do play a role, but
Mm-hmm.
alone they cannot play any role. So, they are just supportive therapies.
Mm-hmm. Okay, so they are supported therapy. So, doctor, like in this internet and social media, there are so many this herbal plant extract, phytoconstruent. They say they can help in managing with this alopecia and hair loss. So, can they do that?
See, personally, I think they say that okay, there are some ingredients like you must have heard of it, bhringraj and this moringa and rosemary, our traditional aloe vera. All of these, they are said to improve the circulation, and they are there in many of the hair oils and some I think herbal shampoos also.
Mm-hmm.
I feel, see, traditionally they might have some role to play, but I
Mm-hmm.
think a lot of scientific research is still required for us to actually believe into them. Because
Mm-hmm.
personally, I don't have too much faith into it, but I feel if I have some scientific evidence in my hands, then maybe yes. So I think it's a lot of research should be done in that area, I think.
Okay. Okay. So, doctor, like, even these, like, there are like some omega 3, omega 6, and these fatty acids, this grape seed. People say they promote hair growth. So, do they promote hair growth?
See, omega-3 fatty acids are actually good fatty acids, which which their role is to decrease the inflammation in your body overall. They are very good. Even in acne patients with a lot of pimples and acne, we give them also. So
Mm-hmm.
it has a good anti-inflammatory role. So
Mm-hmm.
I would say that they can, they are basically going to act on your hair follicles to keep them
Mm-hmm.
strong, to avoid
Mm-hmm.
any kind of inflammation around them. So
Mm-hmm.
that ways they might help you give, good quality, maintaining the quality of hair. That I can say. But promoting hair growth per se is again area of, which requires a little bit of more research. But
Mm-hmm.
yes, it will improve the quality of hair, the thickness of hair, your hair follicles will be healthy. So omega-3 is good. But
Mm-hmm.
then promoting hair growth by itself, that's something which again needs a lot of research.
Okay, so research is still required, and
Yes.
yeah, yeah, yeah. So we cannot depend on that. Instead of that, we should depend on our doctor. Yeah. Doctor, like when we talk about diet, there are so many nutrients like macro, micro. So confusion is there. So can you please enlighten us today, like what is this macro and micronutrients in our hair health, which is important in
Yeah.
our diet also? Yeah.
See, macronutrients are the ones which are macro, as the word says, we need in larger quantities. So these are like carbohydrates and fats and proteins.
Mm-hmm.
But micronutrients are basic vitamins and minerals which our body require in very less quantity, but then deficiencies of these vitamins and minerals result into various other problems that we face. So, like
Mm-hmm.
for example, vitamins. Now, vitamin A, now B complex. Now, B complex has got biotin, which is again very important for hair.
Mm-hmm.
Niacinamide. Then it has vitamin B12, vitamin
Mm-hmm.
C, D, E. All of these vitamins are very important for the hair. And then
Mm-hmm.
there are these minerals like zinc, manganese, copper. All
Mm-hmm.
these, I mean, all these micronutrients are very important for the strength of the hair and also to replenish the deficiencies which is there because of our the diet that we take certain way in our society, in our different communities. The Indian diet. So we do
Mm-hmm.
have certain deficiencies.
Mm-hmm. Okay, so deficiencies are there. So, doctor, like like nowadays we tends to become our own doctor, and we prescribe ourselves so many nutrient supplement. So, is it required to take this nutrient supplement as per gender or day requirement with the help of a doctor, or is it okay if we take like social media से ये खरीद लिया वो खरीद लिया? Is it like fine, or is it required to take as per the dietary guidelines?
Well, see, DA itself is the recommended dietary allowance. Now, this
Mm-hmm.
term is there because there is a certain requirement in the body. As I said, these are required in very little amount. So, this should be gender specific, of course. But why to
Mm-hmm.
follow this is if the vitamins are in excess, then also they
Mm-hmm.
create toxicity in your body. For example, hypervitaminosis A. This is a condition where vitamin A is in excess in your body. So, this is a toxic condition.
Mm-hmm.
Hypervitaminosis B. Again, this is a toxic condition. So, so these have to be. taken as per the RDA. You
Mm-hmm.
cannot just have it in excess. It is going to cause more harm than any benefit.
Mm-hmm. Yeah, because there are so many gummies. खा लो
Yes.
बाल उग जाएंगे.
And these
So
gummies have a lot of sugar in them. I just don't understand. These appear very fancy, but they have all those artificial colors and those sugary things added in them. I think
yeah.
they're not that. I don't know if they are going to help more or they're going to damage more. So you should be really
Mm-hmm.
particular about what you choose.
Yeah, yeah, yeah. So that's very interesting. So these sugary nutrients we should avoid. So doctor, like after the hair loss, and we there is another very common problem between all of us is the dandruff. So do you think that dandruff can cause hair fall, or is it required to take dandruff seriously?
Very seriously. Because, see, as I said earlier, scalp hygiene, coming back to it, if dandruff is there, please go see your doctor, treat it with a medicated shampoo and whatever is required. Don't self medicate yourself. And if you
Mm-hmm.
keep on having dandruff, you will. Dandruff means itchy scalp basically. And if you keep on itching your scalp, you're going to harm your follicles and scalp. Dandruff is a very important cause of hair fall, and also it can give you acne on your forehead, on your back, shoulders. So treating dandruff is very, very, very important.
Mm-hmm. Okay, so including like diet and other thing, dandruff is also very important to take care of it. So, doctor, you said earlier you said that in lifestyle, the stress is also like a reason of causing hair loss or hair fall. So, can you please enlighten us today because we are all stressed out. So, can you please enlighten us today the impact of stress and how to manage the stress for our like for our hair health?
Well, I think stress management, even I think I need a class on that because, see, everybody is having stress in their life. Be
Mm-hmm.
it anything, just little things in your life, day to day things, and you are stressed out about everything. But stress is, it is going to increase your cortisol levels. It's going to affect your hormones. So stress
Mm-hmm.
that way is, it is indirectly affecting your hair basically. So
Mhm,
through affecting certain things in your body like your hormones and
mhm,
other things, it is going to
mhm,
affect your hair. You're not going to sleep properly if you're stressed out. You're not
mhm,
eating properly again because of stress. Then again, your
mhm,
hormones are out of control. There is
mhm,
PCOD, which could be linked to it. So there are so
mhm,
many things. And as I
mhm,
talked about physical stress, which could be due to any minor procedure or any viral or
mhm,
any other infection in the
mhm,
body. So stress,
mhm.
yes, indirectly, lot of hair fall.
Okay, okay. So it's very important to manage the stress as much as
Yeah.
possible. So डॉक्टर जब हम स्ट्रेस में होते हैं तो एक बड़ी कॉमन चीज है जो हर मदर हमको प्रेस्क्राइब करती है विच इज लाइक ऑयल का मसाज कर लो ऑयल के मसाज से बाल लंबे घने और लगा लो जितना लगा सकते हो कि इससे लंबे बड़े घने बाल होंगे स्ट्रेस से भी रिलीफ हो जाओगे सो व्हाट डू यू थिंक ऑयलिंग हेयर इज अ बून और अ बैन
I think I cannot pick boon and bane because I think it's a oiling. I see it in a different way. If you're putting oil in your hair and not washing your hair for next 3 to 4 days, then you're damaging yourself, not benefiting. So if see the main actions of oiling should be कि एक gentle scalp massage हो जाए कि थोड़ा circulation improve हो and it gives you relaxation. And the other important benefit should be to nourish and condition your lengths, right? So it can be done and achieved if you're just keeping the oil for like say 2 hours before hair wash or maybe a night before. I think that's more than sufficient. But keeping the oil for such long period of time and कुछ लोग क्या करते हैं hair wash करके also they apply oil again. So ये कुछ practices हैं which I think should not be done. In that ways फिर वो ये oil के फायदे भी हैं नुकसान भी हैं.
ओके सो लाइक वो लगा के ओवरनाइट सोना ये सोच के बाल सुबह लंबे हो जाएंगे वो दैट्स नॉट ट्रू so doctor now my favorite part can you please give us some important tips for healthy hair
Yeah. See, first and foremost, scalp hygiene. I'll always emphasize on it because we cannot neglect this. Even pillow
Mhm.
cover should be changed at least twice a week because we are sleeping on it. Our hair are actually laying on it. Next
Mhm.
is to condition. Conditioner
Mhm.
should be used after every hair wash. And,
Mhm.
we should avoid combing our hair, when they are wet. We should
Mhm.
avoid very tight hairstyles, very tight ponytails, tight buns. You
Mhm.
start seeing that your hairline is receding. So
Mhm.
tight hairstyles should not be done.
Mhm.
Then, we should, then of course, eat well. And
Mhm.
eating, of course, as we've discussed, so important. You should
Mhm.
have good amount of protein in your diet and other vitamins that are important. Then heating tools. Nowadays, a lot of heating tools that we use. So try to minimize the use of heating tools. I would not say that don't use it, but try
Mhm.
to minimize it or use a heat protectant.
Mhm.
And I think that's all. And there are so many other things which need some serious discussion. So you need to, and some depth to go into. So you should definitely see your dermatologist and,
Mhm.
let them do their job and
Yeah.
find out what's happening.
Mhm. Yes, doctor, very interesting. So this discussion was very informative. I'm sure our viewers have found the session very helpful. Now there are a lot of questions people are been asking me. कि पूछो पूछो पूछो. So can I take some live audience question?
Yeah, sure. Please go ahead.
Yeah, so the first question is from our viewer is Doctor, my crown area hair is very, very thin. My scalp is visible. I want treatment PRP और GFC. PRP GFC से मेरे thin hair हो सकते हैं क्या और scalp दिखना बंद हो सकते हैं क्या? And he also asked that hair follicle है मेरे like a very silk. So it's very
Okay, so
confusing. I
second.
think so. उसका scalp दिखता होगा and he wants some treatment like called PRP and GFP. And according to him, his hair is thin. So क्या बाल भी वापस आ सकते हैं और hair thick भी हो सकते हैं क्या? That is the question.
See,
Yeah.
the important thing is the key age kya hai. We need to know the age also, and also key if the patient is young, we have to
Mhm.
treat that way. If we have a lot of time, sometimes the patients are in a very hurry because they are getting married, say after 9, 10 months, and they want to get hair immediately. And we
Mhm.
need to see the severity, the grading of the hair fall. See, अगर
Mhm.
आपके crown area खाली thinning है, then you should
Mhm.
definitely, I think minoxidil start करने का time आ गया है. And
Mhm.
उसके साथ में PRP यूज करना चाहिए और अगर PRP नहीं तो आप GFC थेरेपी भी कर सकते हैं. So it has
Mhm.
to be a collective approach. Since the
Okay.
crown is काफी, like if you're saying scalp visible है, तो collective approach चाहिए ही चाहिए अब.
Mhm. ओके सो आजकल सलून वगैरह भी ये पीआरपी वगैरह देते हैं सो आई थिंक सो इफ ही इज टेकिंग सम एडवाइस फ्रॉम एनी अदर पीपल इट्स बेटर ही विजिट टू द डॉक्टर एंड गेट द ट्रीटमेंट
Yes, yes.
या no because minoxidil should be taken with the help of the doctor
Yes.
only yeah
Yes, because there are a lot of precautions along with it which you should know. Because when you
mm-hmm.
start using minoxidil, there is immediate little bit of hair shedding because all the weak roots will shed. So sometimes people, they have a misconception about minoxidil that we will not use it, otherwise हमारे जितने बाल हैं वो भी झड़ जाएंगे.
Yeah.
So it's important for your doctor to explain it to you that how to use it and
Mm-hmm.
when to use it and how much to use it. So that is important.
Okay, quite interesting, doctor. Another question. Hello, doctor. मैं भी बिलासपुर छत्तीसगढ़ से हूँ. मुझे आपको विजिट करना है. मुझे मेनोपॉज है. मेरी नेबर ने कहा कि मेनोपॉज के एज में जब बाल झड़ते हैं तो हार्मोन थेरेपी से बाल वापस आ सकते हैं. तो क्या मैं आपके पास आके हार्मोन थेरेपी करवा लूँ?
Well, you're most welcome. Please come and visit me. Let's go into details of what you're going through, how your scalp looks like. And she mentioned about hormone therapy, right?
Therapy, yeah, at a menopausal age.
Yeah. See, hormonal therapy is okay, but I don't think alone the hormonal therapy can bring your hair back. We need
Mm-hmm.
to again, see and judge what is required, and
Mm-hmm.
then we can guide you in that way.
Okay, okay. So like it's not nothing like कि एक alone approach help करेगा.
Well, yes,
Yeah. Combination
absolutely.
of approach can help. Okay. Another question from our viewer is, Doctor, my daughter is 12 years old and she's having a lot of gray hair at such a young age? Can it be stopped? What is the problem? Is it genetic?
See, if it is genetic, then you have to answer one question, that is early graying is running in your families or not. So that you need to tell me. Otherwise,
Mm,
if it is not genetic and you feel that she is the only one who's had this problem in the family, then
mm,
definitely vitamin D and vitamin B12 levels should be tested, because they are going to be really low, it means.
mm,
And
mm,
we should also rule out some other hormonal imbalances also. And
mm,
there are treatments, for handling graying of hair and
mm,
getting. See, what we can do is we can prevent other hair to get gray, and whatever
mm.
is gray, that will take a lot of time to get its pigment back. So it's going to be a
Okay.
long term process, but yes,
Mm,
this problem is, there is a solution to this problem as well. And please
mm,
get your vitamin B12 and vitamin D tested. It's very
mm,
important.
mm. Okay. Okay, so another question from our viewer is, डॉक्टर मुझे मैं भी छत्तीसगढ़ से हूँ, मुझे 2 साल पहले एक एक्सीडेंट हुआ था जिससे मेरे बर्न होने से बाल साइड से बाल चले गए, वहाँ पे स्कार रह गए, मैंने बहुत कुछ लगाया, बाल वापस नहीं आए। आप हेयर ट्रांसप्लांट करते हो क्या? हेयर ट्रांसप्लांट से बाल वापस आ जाएंगे क्या?
यस, सी स्कार, अगर आपको स्कारिंग एलोपेशिया हुआ है पोस्ट ट्रॉमा, तो उसमें मेडिकल ट्रीटमेंट्स उतना हेल्प नहीं करते, टू बी ऑनेस्ट। आपको डेफिनेटली प्रोसीजरल ट्रीटमेंट्स एंड सर्जिकल ट्रीटमेंट्स ही लेने पड़ेंगे। So we need
हम्म
to, we need to give you a variety of options that you have, and then accordingly you can go ahead. But please don't waste your money on medical treatments like topicals and orals, because they are not going to help you. Already जो
हम्म
post ट्रॉमेटिक आपकी स्कारिंग है, तो आपके फॉलिकल्स पक्का डैमेज हो चुके होंगे। So once your
हम्म
follicles are damaged, it's very difficult to get hair, when follicles ही नहीं है तो hair कहाँ से आएंगे? So
हम्म
definitely we have to think of transplant or something else. So again, we need to know your age, we need to know other things also. So please visit
हम्म
us. We'll take out a solution for you and
हम्म
guide you.
Okay, so he asked that he can visit you or not. So I think so he can visit you. Yeah. So another, I'll quickly take last question from our audience because we are running out of time. This person is asking, डॉक्टर मैं बहुत सारे डॉक्टर्स के पास जा चुका हूँ, सब मुझे भर भर के वाइटामिन और मिनरल्स दे रहे हैं, मुझे एंड्रोजेनिक एलोपेशिया है, क्या मुझे यह पूरी जिंदगी लेनी पड़ेगी?
वेल नो। अगर आपको एंड्रोजेनेटिक एलोप्लेशिया है तो वाइटामिन्स एक हद तक ही, एज वी डिस्कस जस्ट नाउ,
हम्म
वाइटामिन्स विल अलोन कैन नॉट गेट योर हेयर बैक. You need to
हम्म
take proper treatment, like maybe oral minoxidil we have to give you. We have to see कितना severity of balding है, उस हिसाब से topicals आपको strong देने पड़ेंगे. We have to see the strength of minoxidil that we can give you, maybe 5%, 10%, depending on whatever is required. So we have to go on, like we have to have an aggressive approach in your case. We can't
हम्म
just rely on vitamins and minerals. And then you need to take certain procedures like
हम्म
PRT or GFC therapy. There are so many things we can do. But please,
हम्म
taking vitamins and AGA for a long process, it's not just going to give your hair back. It's just going to prevent further loss, but maybe not give you your lost hair back.
Okay, okay. Uh, it's time to wrap up, but the thing is, I want to ask this question, which this person asked, because I think so. Most of the common people don't know this. So he's saying कि क्या dermatologist transplant करते हैं क्या, या transplant के लिए कोई और doctor है क्या?
Okay, this is a very good question. Very,
Yeah,
very good question.
I
See,
took
I'll
that.
tell
Yeah.
you one thing. Uh, ट्रांसप्लांट तो आजकल ना कोई भी कर रहा है,
Mm,
चाहे सैलून चले जाओ, चाहे टेक्नीशियंस, कोई भी. बट यस, प्रॉपर क्या कर सकते हैं, प्लास्टिक सर्जन्स कैन डू अ ट्रांसप्लांट.
mm,
Then your dermatologist can do transplant if they have done fellowship in plant hair transplant, or
mm,
they have done some other super specialty courses in hair transplant. Then they
mm,
can do hair transplant. And
mm,
plastic surgeons can do it if they have a fellowship in that, and usually they do have it because वो
mm,
उनके curriculum का part है. बट ये जो आजकल डेंटिस्ट हों, चाहे आजकल कोई भी टेक्नीशियन हों, सैलून्स हों, there has been a casualty in Delhi recently. A
mm,
very young man died in a salon in Delhi because of hair transplant. So
mm,
yes, this is something which you should keep in mind. You're spending so much money on a transplant. Please,
Mm,
you should know your doctor well before you're actually going for such a big procedure. That is very important to understand. This is a very, actually, this is a good question. Everybody
yeah.
should know this.
Yeah. So I asked this question, and was still we are running on, and I'm still I asked because there is a lot of confusion between people.
Yes.
Yeah, because most of the males are like at a stage where they need to go for a transplant, and they are always confused. किसके पास जाएं, किसके
Mhm.
पास नहीं जाएं, you know. So, anyways, doctor, can you please give us some take-home message or any other suggestion to our viewers today?
Well, I would just say one thing. Please eat properly, eat healthy, actually, I should say. Choose wisely what you're eating, choose wisely what you're applying on your hair. Don't just follow for everything and anything that is available on social media or anything that's available online. Just see to it that whatever you're buying, whatever you're eating, wherever you're spending your money, it should be worth it. And if you're confused about these things and your dermat is here, you please
Mm,
go and see your nearest dermatologist. And also, जैसे आपने पूछा hair transplant कौन करता है, प्लीज अपने board certified dermat के पास ही जाइए. Don't go to anybody or don't
mm,
go to any beauty parlor and ask those therapists कि मैं क्या करूं, मैं क्या लगाऊं. So
mm,
please choose wisely, be it
mm.
anything.
Okay. Thank you so much, doctor. Thank you so much for the suggestion and for sharing all your expertise with us today and answering all the questions of our viewers today. And it was really, thank you so much. It was really a delight to
Thank
have
you
you,
so
and
much.
thank you so much for
Thank you
your
so much.
valuable time. Yeah.
Thank you for
So
having me on the show.
thank you, ladies and gentlemen, also to for participating so actively and asking questions to our doctor. And I hope we'll take the appointment of our doctor again for another topic which is related to our hair and skin condition if she has time. So until then, we are signing off for today. Thank you so much, doctor. Have a nice evening.
Thank you. Thank you. You too.
Yeah,
Thank
bye
you.
bye. Bye bye.
Bye. Bye, everyone.
Bye everyone.